I am Dr. Obagi, and today we're going to be doing some temple filler. We have our lovely patient here today. She's coming in mainly because she notices some concavity around her temples, and it feels like her face becomes a little bit more narrow in that area, and she wants to restore the fullness that she used to have maybe 10, 20 years ago when that area was more full of volume. And by volume, as we age, we naturally lose fat in certain areas of our face. We even gain fat in different areas of our face. One of the main areas we can lose fat in is our temples. So using filler in this area is a great way to restore volume into that area, restore the natural shape that we used to have. If done correctly, it's very safe. One of the main complications that can happen in this area is that it's a very vascular area. You want to avoid hitting any major arteries or veins, and usually you want to be able to put the filler exactly where it needs to go. The easiest way to get started is to analyze the face. Look for the area of the most depression on the temples, and on average that tends to be about 1 centimeter above the brow, 1 centimeter back, but it's not the same on everybody. We want to still analyze the face, look to see if that lines up with where they have the most deficiency in volume. You can even ask them to clench for me. You have to feel that you're on that temporalis muscle. And then prior to getting started, if you want to do some physical exam techniques, you can palpate this area, make sure you're not overlying any temporal artery in this area. And in fact, not every office has this, but we use ultrasound as well to confirm that there was no vessels where we're about to place the filler. The most important thing to do when you're doing filler in this area is to aspirate, because you want to make sure again that you're not in any vessels. When we get started here, you want to go perpendicular. Essentially make sure you touch when you're touching bone, you aspirate. Here you want to hold it firmly, pull back on the plunger, make sure there's no blood flow. And as you can see here, you want to wait maybe a few seconds, make sure that there's no blood flow, and once you confirm the safety, then you can deposit the filler. Once it's in there, you can safely come out. Now for patients that might feel a little weird to them, it doesn't necessarily hurt. What they might notice over the next couple of days is upon clenching their teeth, which this is a muscle that involves clenching, then they might feel like there's a little bit of soreness there. That goes away over the next couple days. What you don't want to see is any sort of blanching or extreme pain. So that's one syringe on her left side. She sleeps on her left side, so she notices a little bit more fat loss there. Does it feel sore?
No.
So today we're using Voluma. It's on the firmer end. Good choice for this area. There's also a really deep hollowness. You can pick one that's even firmer than that, but firmness refers to how pliable and soft the filler is. There's some that are super watery. We like to use those around the lips. There's some that are super firm and rock-like. We like to use those around the chin and jawline. Yeah, it's starting to look really good.
I think it looks good.
Yeah. Right now I'm massaging. It's not going to necessarily move all the filler all over the place, but it does help make sure that it kind of blends and also prevents any extra potential complications. But right now I'm just using our ZL firming serum, but it's a good agent that is very glidey. We just completed her temple filler. Now her left side required more than her right, and she does sleep on her left side, so that's not unusual where one side might be a little off compared to the other. But having put the right amounts into each side to make them even, now she has no more concavity in her temple area. It looks nice and flush with the rest of her face. And this brings back a more youthful look to the face, because this is how it was 10, 20 years ago before the volume loss really started kicking in. Now that her temples are nice and full, she's happy. She can tell and see the difference. And also, she was just telling me, were you in any pain at all?
No.
Okay.
Nope.
And any pain right now?
Nothing.
And that's how it should be. So I don't expect any issues after this. She can enjoy her temple filler now for the next 1 to 3 years, depending on your metabolism, and eventually we repeat it again.